Hi there, this is Dr. Judd Wattenbarger again, and I want to congratulate you on making it this far in the videos. Today we're going to explain what can be the missing link for the cause and the treatment of neuropathy. Now, we know that neuropathy has hundreds of documented causes. There's diabetic-induced neuropathy, there's injury-induced neuropathy, there's chemical exposure, things like Agent Orange, burn pits, these sorts of things that can cause neuropathies. We know that there's post-surgical, post-chemotherapy neuropathies, and there's even one called idiopathic neuropathy. It's really, really common, which means we don't know the exact cause, but we know that you have the symptoms. Now, we know when these neuropathies start, they're degenerative and they're progressive. So let's actually talk about the root cause, the why of neuropathy. So I'm going to encourage you to watch this whole video. It's just a few minutes, but it might be the information that you've never gotten in the past. So many of the neuropathy symptoms stem from blood vessels degrading. So let me illustrate this. My hand here is a nerve cell. This is the body of the cell, and all the processes of life move through this nerve cell. Now, over time, these little blood vessels that are connected to that nerve cell can shrivel and die from all of the processes that we just talked about. And as they continue to shrivel, that nerve cell doesn't get the nutrients that it needs. It can't breathe, and so it dies. This is very much like if I get a cavity in my mouth. I can have a cavity and not have any symptoms for a very long time, but it's there and it's continuing to degenerate my tooth. And then one day I'll take a drink of cold water and wow, all this pain, and I've got this bad cavity, and if I let that go, I'll eventually wind up with a root canal. Our nerves are very much the same thing. When this process starts, we don't always feel it. And that's why I have people that come to me, I've been dealing with this for months or even years, because this process has been going on slowly for many months or years. So the program that we use here in this office is focused on regrowing those small blood vessels around the nerve so that the nerve can breathe and heal. And this is the treatment that stops the progression of neuropathy in its tracks and allows it to reverse and heal that nerve long term and allow you to get back to the life that you deserve. Now, I've mentioned before in a previous video that for people that we can accept into our program, we have an over 90% success rate. What does that mean to you? That means you can get your life back. So I encourage you to keep your appointment with us. We get so excited when people come in and we can help them. I'm also going to encourage you to bring your significant other, your boyfriend, your girlfriend, your best friend, someone who makes health decisions with you and, more importantly, can be your cheerleader through this process. So if you've never had an examination to check for that blood vessel damage, that cause that we've identified today, it's time for you to get in here, let us do an examination, and let us determine if we can help you.